Eating disorders are more prevalent than ever, and eating disorders actually have the highest mortality rate amongst all mental health issues. So it's not just about body images. The eating disorders affect every aspect. It affects you mentally, it affects you physically, and the physical and the mental are connected in that regard. Chemically, it affects families too, figuring out how to deal with this. Obviously, people have different types of eating disorders. There's anorexia, there's bulimia, there's binge eating, binging and purging, EDNOS, which is eating disorders non-specified, which you can't really classify under any particular one of the other. You can have an eating disorder and not necessarily have a body image issue, but a lot of people tend to have the body image issues with the eating disorder. But really, somebody who has an eating disorder is using food in some way to cope with their mood. Okay, so most of the time when we see someone with an eating disorder, they do have some type of trauma in the past or going on in their life. Usually what it takes is a kind of like the perfect storm of events in order to bring about somebody with an eating disorder, and it's really a counterfeit means for the person to get what it is that they truly want for themselves in their lives. So typically they're trying to escape some type of a problem, and they're trying to get into a sense of peace and freedom and relaxation and sense of control, and that eating disorder voice is really telling them this is the way to do it.
And is that with young kids as well?
Oh yeah, young kids. Eating disorders are affecting men, women, boys, girls. It doesn't discriminate. It's really affecting a lot of people. And then of course we have the media images and society's images and how that's also impacting. People can develop an eating disorder again as it's a maladaptive way to cope with emotional issues and problems that they're having in their life.